Hey guys, this is Tony and welcome back to BorderlineHR. Today, let's talk about splitting in general and about splitting in borderline personality disorder. Splitting is the failure in a person's thinking to bring both positive and negative qualities of the self and others into a realistic, cohesive whole. It's a common defense mechanism where the individual tends to think in extremes. This means an individual's actions and motivations are interpreted either all good or all bad with no space in between. Splitting was first described by Ronald Fairbairn in his formulation of object relations theory. It begins as the inability of an infant to combine the fulfilling good aspects of their parents with the unresponsive bad aspects. Instead of being able to combine them into the same individual, they are seen as separate. In psychoanalytic theory, this functions as a defense mechanism. One of the DSM criteria for borderline personality disorder is basically a description of splitting. A pattern of unstable and intense interpersonal relationships characterized by alternating between the extremes of idealization and devaluation. People matching the diagnostic criteria for narcissistic personality disorder also use splitting as a central defense mechanism. Most often, narcissists do this as an attempt to stabilize their self-positivity in order to preserve their self-esteem. By perceiving themselves as purely upright and admirable, and others who do not conform to their will and values as wicked or contemptible. The cognitive habit of splitting also implies the use of other self-defense mechanisms, namely idealization and devaluation, which are preventive attitudes or reactions to narcissistic rage and narcissistic injury. For people with BPD, splitting is done unconsciously in an attempt to protect against intense negative feelings like abandonment, loneliness, shame, and isolation. Splitting causes a person to see or view everyone in black and white, in absolute terms. It stops us from being able to realize and accept paradoxical qualities in individuals or situations, and doesn't really allow any gray areas in our thinking. In other words, when a person with BPD splits, they may suddenly characterize people, objects, beliefs, or situations as all good or all bad. This happens even though we know that the world is complex and that good and bad can exist together in one. A person with BPD may experience splitting in ways like people will be seen as either perfect or evil. Something will always or never go right. Someone will always or never be loving. Seeing and responding to the world in these extremes through either a filter of positivity or negativity can leave the person with BPD exhausted. It can also lead to strains and fractures in our relationships, as those close to us become more and more affected by our behavior. People with borderline personality disorder often struggle with intense emotions and struggle with the concept of good and bad being able to be present on the same person at once. Splitting allows us to tolerate difficult or overwhelming emotions by seeing someone as either good or bad, idealized or devalued. This makes it easier for us to manage the emotions, even though at first glance this may seem contradictory. Those with BPD also often seek outside validation without consideration for their own emotions about themselves, objects, beliefs, and situations. This can make us more prone to splitting as we attempt to shield us from anxiety caused by potential abandonment, loss of trust, or betrayal. A common symptom of BPD is emotional dysregulation. This is where a person is less able to manage their emotional responses than a person without BPD would be. Therefore, when a person with BPD splits, they will likely react in a way that falls outside of what was expected. These extreme emotions can be exhausting for the person with BPD as well as those who are close to them. When perceiving something or someone as entirely good, this can make you vulnerable to harm and to danger as you become unable to see the associated risks. Also, when believing a person is completely perfect, this can lead to a codependence. When a real or perceived slight is experienced by a person with borderline personality disorder, this can cause them to feel disappointed, betrayed, unloved, or abandoned and view the other party as entirely bad. The individual may then become angry or withdraw themselves completely. They may also become incredibly angry at themselves. As you can see, splitting can interfere with relationships and can lead to intense or self-destructive behaviors. A person who splits will typically frame people or events in absolute terms with no middle ground for discussion. Examples of splitting behavior would include stuff like opportunities can either have no risk or be a complete con. People can be either evil or crooked or pure and perfect. Science, history, or news is either complete fact or absolute garbage. Things are either always or never. What makes splitting all the more confusing is that the belief can sometimes be ironclad and shift back and forth from one moment to the next. By itself, splitting almost seems commonplace, a behavior that we can attribute to a lot of people we know, and maybe even ourselves. However, splitting in BPD is considered a consistent and distorted behavior, usually accompanied by other symptoms. Those other symptoms can be stuff like acting out, so acting without consideration for the consequences, denial, consciously ignoring a fact or reality, passive aggression, projection, which means assigning an undesirable emotion of oneself to another person, and projective identification. Splitting often occurs psychically and very suddenly. A person with BPD can see the world in its complexity, but their feelings often change from good to bad extremely fast, and rather frequently. A splitting episode can last days, months, or even years before shifting. A split is typically triggered by an event that causes a person with BPD to take on extreme viewpoints. These events may be relatively ordinary, like taking a business trip, having to travel, or getting into an argument with someone else. Often, triggering events involve minor separations from people we want to feel close to, which sparks our fear of abandonment. You can identify splitting through the language the person with BPD is using. Like I said before, never, always, all good, all bad, perfect, evil, and so on. Splitting is a defense mechanism commonly developed by people who have experienced early life trauma like abuse or abandonment. Long-term treatments involves the development of coping mechanisms that improve your perspective on what's happening in your life. Reducing anxiety can also help. If you need help in dealing with the splitting episode, here's what you can do. Calm your breathing, focus on your senses, be mindful. Check out my videos on skills in DBT and on dissociation for more suggestions. Also, reach out. If you find yourself splitting, consider reaching out to your mental health care professional. They may be able to calm you and ease the split that's happening. While it may be difficult sometimes, coping with the symptoms of splitting is possible. It's not that easy to help a person with BPD who's experiencing splitting. You may feel at the mercy of their symptoms, but if you feel capable enough to help, here are some tips. First, learn as much as you can about borderline personality disorder. It's easy to get offended by the up and down behavior by someone with BPD, but the more you know about the condition and how it can affect their behavior, the more understanding you will have for your loved one's behavior. Second, know your loved one's triggers. Often, the same events over and over again are BPD triggers. Knowing your loved one's triggers, alerting them, and helping them to cope may prevent a splitting cycle. Third, remember that splitting is a symptom of borderline personality disorder. While it can be difficult not to take our words and actions personally, remember that the person with BPD is not intentionally trying to hurt you. Splitting is something that they do unknowingly. 4. Think about how you respond to the person that's splitting. Try to remain calm, and if you find this difficult, give yourself the opportunity to calm down and postpone the conversation. 5. Show the person with BPD that you really do care. Someone who's suffering from BPD is likely dealing with feelings of abandonment, isolation, and loneliness. Therefore, try to show the person that they are cared for, that they are seen, and that they are heard. 6. Set healthy boundaries to help manage behaviors. Work with the person with BPD to set limits, so they can understand the behaviors that you won't tolerate. While these boundaries may be unintentionally challenged at times, make sure to stay true to the consequences that you've told the BPD person things will have. It's also very, very important for you to encourage the person with BPD to get the right treatment and be an advocate for it when they do so. So, you may have noticed that over the course of this video, there were a few moments where I became quite distressed. Splitting is one of my least favorite topics, and I hate talking about it. But here I go. So, there's no conscious decision to split. Even if I try, I couldn't. A sufficiently strong enough trigger can still cause me to fall into this defense mechanism. It's not that easy for someone with BPD to recognize splitting themselves, especially not without therapy or without knowing about it. Like, if someone hurts you, you would get mad, right? But you wouldn't think of this being mad as splitting, right? And it's the same way for us because we're so used to it. I hate it when it happens to me. This wave just crushes into my mind, overpowering my wise mind and coloring everything in black and white. If it's idealization, it's very hard for me to not lose myself in the connection to the other person. If it's devaluation, I'm in intense pain, I'm angry, I'm disgusted, which I really just want to stop. Splitting makes me question myself and my actions even more, as it sometimes can feel like your mind is not your own. Someone just pushes a button and you're left going through the motions. This feeling of disorientation, helplessness, and shame if you chose to act on your feelings and look back afterwards is awful. DBT helped me to be more aware of it happening, and with the skills that I've learned in therapy, I'm able to control it more often, but it still can happen for me. So yay, that was my shame exposition for today. Thank you for watching. Do you have any questions you'd like me to answer, or borderline related topics you'd want me to cover, or experiences you'd like to share? The comment section is yours. Please also don't forget to save the like and subscribe button from their respective feelings of abandonment, and see you next time. Be kind to one another.